Physicians, hospitals, and insurers, including CMS, the organization that takes care of providing Medicare benefits, are looking for innovative strategies to improve the way you get your health care. And one of those strategies is the use of accountable care organizations. Accountable care organizations are groups of physicians, healthcare providers, hospitals that work together to achieve what's called the fourfold or quadruple aim. The quadruple aim includes improving the quality of care that patients get, making the most value or reducing cost of care, improving patient satisfaction and patient engagement, and then also increasing the job satisfaction of the people who work in healthcare. So that's the fourfold aim. And what I'd like to do is talk a little bit more in detail about the quadruple aim, and then discuss a little bit about my group that has joined a Medicare Shared Savings ACO, what our goals are as a group to achieve this quadruple aim. And then we'll talk a little bit about what patients can do, especially patients that are in an ACO. What can you do to help this be successful? So the quadruple aim, first off, involves quality. How do we know we're doing a good job? Well, we've got to be able to measure that. And so things that we can measure as primary care doctors: blood pressure. Are our patients' blood pressures being controlled? Are they getting in for the regular checks of their diabetes, and is their diabetes being well controlled? Are heart patients on the right medications? Are we doing the cancer screens that need to be done? Or do people understand their medications? Are they getting the immunizations that they need? And then we can just look at the hospital. Are we keeping people out of the hospital? That's an important way we can measure quality. If they're in the hospital and they get discharged, are we keeping them from ending up back in the hospital? Those are some important ways that we can measure quality, one of the big parts of the quadruple aim. Second, cost and value. We want to look at everything that we're doing for the patients and make sure that it really is making them healthier. If there's dollars that are being spent on things that don't really improve a patient's health, well, we need to redirect those dollars to things that really matter, that do improve the patient's wellness and health. And that there's a science behind that. There's a lot of studies and there's a lot of experts that guide us as members of the ACO in finding the things that we can spend time and energy on for patients that really are going to improve their health. And then engaging the patients. We know if a patient understands their health and cares about their health and feels like they're a partner with their doctor, they're going to do better and be healthier. So we're trying to find innovative ways to accomplish that. And then just looking at the patients who are the people who work in healthcare, making sure that they feel like they're a part of a team and that we're keeping their job satisfaction in mind, that we're not kind of dumping a lot of work on the hospital doctors or home health we want to spread the work out so that around so that the healthcare workers are satisfied in their job and feel that their health and happiness is important as well. So that's the quadruple aim. Next, I want to talk a little bit about our group, my group of doctors, and what we're doing in our ACO. We're again in a Track 2 Medicare Shared Savings ACO, and we joined that about the beginning of the year, and many of the patients don't even know that they're in this ACO. We've got about 8,000 patients. These are just Medicare patients. Our other insured patients won't really notice any difference when they come to our office. But over time, these patients that are in the ACO will notice that we're doing things a little differently, and they'll feel like they're getting better care. One of our, there's really three main goals that our ACO has right now. First is making sure our Medicare patients come in for their Medicare Well visits. Second, we're trying to find our sickest patients and create a team directed by the doctor to help them stay healthy. And third, we're trying to make sure that when people get out of the hospital, that they have a good plan for keeping them healthy and staying out of being readmitted to the hospital. And then just trying to find ways to engage the patient. Those are our main goals. So first off, Medicare Well visits. These are so very important. Medicare provides this for all of the beneficiaries. There's no additional cost to the patient for these Medicare Well visits. The doctor gets paid an additional fee. So when you look at your bill, you'll see, like, if you're there, most of the time we do these visits at the same time when we might check you for your blood pressure and your diabetes. And there'll be sort of two charges, one for your Medicare Well visit and one for follow-up of your multiple medical problems. So what we do is we look at every one of the medical problems that you have, and we try to explain those problems and let you understand what the plan is, the medications that you're taking, the other doctors that might be involved in your care. We try to get a comprehensive plan for each one of your problems. And then we also look at screening for other issues that might be a problem down the line. So we ask questions about depression. We screen to make sure people aren't having memory loss or having problems taking care of themselves. We look to make sure that there's not problems with alcohol abuse or drug abuse or tobacco problems. And then we look to see if people are having frequent falls. And we make sure they've got all their immunizations. And then we discuss with them good nutrition, talk about eating right, avoiding a lot of extra sugar and processed foods, eating 3 meals a day, and getting exercise. So it's kind of a comprehensive plan for staying healthy. And that is shared with the patient. And when we do that, what we find is we can prevent problems down the line. We can prevent that high blood pressure from turning into a heart attack or a stroke. We can prevent that person with diabetes from ending up on dialysis or with amputations. So by doing these yearly Medicare Well visits, we can really prevent a lot of problems down the line. The second goal that we have is during those Medicare Well visits, we try to find those really sick patients. So people who are on a lot of different medicines, see many different specialists, have a lot of problems. Well, they can decompensate. They can get sick fast and end up in the hospital, end up in the intensive care unit or in the emergency room. And if we can add more team members, if we can form a team of nurses and chronic care managers, we can reach out to those people on a regular basis, make sure they're taking their medicines and that they're doing their specialist follow-ups and that they're doing the treatments that they need, that they're coming back to the doctor on a regular basis. Those really super sick patients, if we can manage them better, we're good at it when they're in the office, but we want to manage them even when they're at home and then in different settings, in the hospital, in the nursing home, with home health. So we're trying to form teams that can take care of those really sick patients. And then also focusing on when patients get discharged from the hospital, really looking at that time when people are really vulnerable, making sure those patients get in to see the doctor right away and that we discuss the plan, what happened in the hospital. If medicines were changed around, we try to make sure that those medicines are straightened out and that the doctor, when the patient's in the hospital, has good communication with the specialists and with the hospital doctors, and that we come up with this comprehensive plan. And then finally, to really engage the patients and to make sure that they're partnering. So that's the goal of us doctors and our team in the ACO. What you can do as a patient, if you're a member of the ACO, or just really any patients who have Medicare, make sure you get in for your Medicare Well visit. If you or one of your family members has not gotten in for one of these visits, get in for your Medicare Well visit. If you feel like you or someone you love has really complicated medical problems, ask your doctor about being on this chronic care management plan. This is something that Medicare and CMS really thinks there's a lot of value. They pay doctors extra fees for managing these really sick patients. So it's important, if you feel like you need that kind of care, to reach out to your doctor and ask them if that's appropriate. And then make sure you get in quickly after you've been discharged from the hospital. And then engage your doctor every time you're in to see your physician. There's a really important program called Ask 3 that many patients are starting to engage in. And the Ask 3 consists of 3 questions. Every time you go in to see your primary care doctor, ask them these 3 questions. First, what is the most important thing? What is the most important problem or challenge I have in my health right now? 2, what can I do? What can I do to help that problem? And 3, why do I need to do that? What is it going to do for me if I follow that plan? If you ask those 3 questions and good answers to those questions, you're going to be partnered with your doctor and you're going to be healthier and you're going to get better health care. So we look forward to working with our patients in the ACO, and we're looking forward to this kind of ACO team approach to care, patient-centered medical home approach to care, really starting to move out not just to our Medicare patients, but to all the patients that we take care of, so that other insurance companies adopt this sort of ACO model so that we can provide the best care possible to our patients. Thanks for listening.